Last surgery for today, which is Deuk laser disc repair at L5-S1. You can see from the x-rays the patient's had a fusion done before elsewhere, and there's a small disc below the fusion. You can see the degeneration of the end plates with sclerosis, and that's right where our needle is. And I'm calling the L5-S1 disc. The radiologist may call it an S1, S2 disc. It's very difficult to get into, but we're right there. Are you comfy? I'm not going to be able to do a discogram because there is some bone here. I'm going to have to try to get through with the dilator. After we're done with the Deuk laser disc repair here, we're going to move on to the Deuk plasma rhizotomy. Can't do a lot for discogram. We're not going to be able to do a discogram. I'm just going to have to guide down. All right. It's the best I can do. Yeah. So our first thing we're going to do is the DLDR at L5-S1 with a 7mm incision. Then we're going to do the Deuk plasma rhizotomy for a facet problem she has. Let's see. Hold on. Shot. I want to make sure the guide wire stays. Shot. There's a lot of scar tissue. I can feel it as I'm coming out. It's really making it hard. Her story is remarkable for her to get here. They're from Michigan. She injured her back years ago. Nobody paid attention to her. They ignored the poor thing. She had numbness and weakness in her leg. Shot. And they just kept ignoring her. And it was a work-related injury. Shot. It blew her off. And then pretty soon she was not able to control her bowels and bladder. Shot. Because of pinched nerves from her spine injury, which, by the way, happened at work. Shot. Eventually, they took her to surgery and did a fusion. Shot, which you can see. But they neglected to treat this last disc, which is where all of her pain is coming from, below her fusion. Let me see. Yeah. Beautiful. It's a very small herniation. It's not going to take much to fix. And her spine is kind of hyperlordotic. Shot. All right. Take the guide wire out. Shot. Yeah. I'm not going to be able to do too much here. Can already tell the disc is extremely collapsed. May be able to grab a few pieces out. Let's see where we are. Shot. All right, that's it. Yeah, it's terrible. Let's get the fluoro out. Now we didn't get to do the dye, so we're not going to see anything blue. Just leave it.
Suction, please.
This part will be quick, and then we'll go straight to the plasma rhizotomy. All right, laser. Straight to the laser. Huh? Today, yeah. Careful. So once again, we're not going to see our typical blue, but that is disc, and it is herniated, and you can see the amount of inflammation around it. Wow. Look at that. We're not even going to have a sample. That's pretty amazing. That is the herniation right there. Look at all the scar tissue. And the reason I couldn't get into the disc, there was a little shell of bone right behind it, blocking it, huh? I couldn't hear you. The disc injury's been there a long time. Oh yeah, yeah. It's an old injury. I think she injured her back in 14 years ago. This is herniation right here. And the angle is extremely steep for us, so getting all the tools in is hard, but so far it's going quite well, better than I expected. I thought the hardware, the screws and rods would block me more, but actually I was able to sneak in under them. And Dr. Berndes has done a great job keeping her comfortable so she's not moving around. All right, any questions? Let's run the video. Why do people get back pain from a herniated disc? Can you show us, Henry?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
We have a question?
Yes, we have a question from Tom Goretzka on YouTube.
Hi, Tom. Thanks for asking.
Tom,
welcome.
Tom asks, can a disc cause lower motor neuron lesion?
Can a disc cause a lower motor neuron lesion?
Correct.
Absolutely. Yeah, the lower motor neurons are your motor nerves. And the disc can pinch the nerves right at the nerve root. That's a lower motor neuron. Upper motor neurons are the nerves that come from your brain. They travel in the spinal cord. And the lower motor neurons are the ones that originate in the ventral horn, which is the cell bodies of the alpha motor neurons, which are lower motor neurons. All right, we're pretty much done here. Great question. Okay.
Good?
Yep, all done.
Lights on, please. I mean, actually, yeah, please, thank you.
Irrigation. So she didn't have a huge herniation at 5-1. It was small, and we've just addressed it. And now we're going to deal with her facets because she does have facet pain as well. She asked me about her fusion, and I have to look at her CAT scan. She's concerned because the fusion was done in Michigan, and she's worried there may be a screw that's pushing on a nerve root. So I'm going to look at that tomorrow with her. But right now, so far, her surgery here is going quite well. I've debrided the annular tear. There was a lot of scar tissue there, so clearly inflammation. Scar tissue is produced by inflammation. You can't have scar tissue without inflammation. So when you see a lot of scar tissue, you know there's been a lot of inflammation. And what causes that inflammation is the herniation. You could see it on the MRI. There was a herniation at L5-S1, which, by the way, of course, was missed by her doctor in Michigan, which we see all the time, doctors missing things. Unfortunately, most doctors are so busy looking for large herniations, they miss the small things. And the small things can actually be a lot worse. We all know, we all know what a baby rattlesnake is, right? Would you rather get bitten by a baby rattlesnake, a small rattlesnake, or a big rattlesnake? Huh? Yeah, baby rattlesnake is the worst. It has the most concentrated poison. I would rather get bitten by an adult rattlesnake. That said, no rattlesnake is better. But the point is unfortunately, spine surgeons have convinced themselves that the disc herniation has to be big in order to treat it, but that's not the case. The vast majority of small herniations, the vast majority of symptomatic disc herniations are small. All right, we are done. You can end the broadcast. If there's any questions, I'll answer them. Otherwise, we're going to switch over to the rhizotomy.
Our final question is from Tom on YouTube, and he asks, do you have a favorite neuroanatomy book?
Ah, Tom, very interesting. Do I have a favorite neuroanatomy book? Tom, I love the question. It is beautiful. I have never been asked that question before, but you're asking a very interesting question. Neuroanatomy is my subject. And since you brought it up, I'll tell you a little bit about my neuroanatomy background. The most famous neurosurgeon of our time is Dr. Albert Roten, and he was the chairman of neurosurgery at University of Florida in Gainesville, where I did my neurosurgery. He was famous for doing neuroanatomy studies on mostly cadavers, injecting the blood system with latex, red latex in the arteries and blue latex in the veins. And then he would have fellows from Japan, China, all over the world would come to work in his lab and gently dissect out the tissues of the brain to expose different areas, showing the blood vessels and the nerves and the relationships, so neuroanatomy. And then he would take pictures and put it in the journals, and everyone learned anatomy from Dr. Roten. But before I came to the University of Florida at USC, I was actually a neuroanatomy, that was my subject. And every year they have a competition, neuroanatomy competition, called the Retzius Neuroanatomy Competition at Children's Hospital of Los Angeles at USC. And I won that neuroanatomy competition, the Retzius competition, back in 1996. So, do I have a favorite neuroanatomy book? I used a lot to study. There is no one book that you can say is the book. You really need to use a combination of gross dissection using human brains, which you won't necessarily have access to unless you're a medical student or a pathologist, combined with the old stains. And there's a book that shows all the tracks, the connections in the spinal cord and brain. I can't remember the name of it, but it's a book that shows you the stains of all the neurons and tracks and where they connect. I don't have the name. I'm sorry. But that's probably my favorite book. All right, that said, we're done with our broadcast. We're going to continue with the Deuk plasma rhizotomy to treat facet pain, left side, L5-S1. I thank you for joining us, and we'll be back next week with more surgery.